Hello, this is Jennifer Marusak, your Vice President of Governmental Affairs with the Louisiana State Medical Society. Today I'm joined by Dr. Conn, an LSMS member who has graciously agreed to share with us her horrific experience with the disease of mental illness. Dr. Conn and I have actually spoken several times about this disease and how it's affected both of our families. And so I personally am very grateful for her offering to share her story with you. Now, Dr. Conn, I know that this is extremely fresh for you. Not that it's ever going to go away, but I actually think it's most beneficial for our viewers if you start at the end. So please talk to us about the day that you learned that your son Colin had lost his battle with mental illness.
Well, of course, it was a very difficult day, and I got a call from his doctor that he didn't show up at his appointment, and I just knew in my heart he was dead because he just wouldn't do that. And so I knew he was at his apartment. I suspected that anyway, and I had my husband call the police because I wanted the police to go first to help in this situation. I thought it was best that way. And I went to my sister's house in Baton Rouge, and my husband went and met the police who went in, and he had died of an intentional overdose of his medicines. And it was a peaceful scene, and he left a note, and that's how we knew.
Let's go back. Who was Colin growing up? What kind of young man had he become prior to his diagnosis? And then also, when or how did you know that he needed help?
Right. Well, Colin was a wonderful, mischievous, very bright kid, and he really didn't have any difficulties all through high school. He was just a wonderful athlete and kind of came into his own academically in high school. But I did notice that he had too much energy sometime, and he did have some mild depressions, and I knew there's a family history of bipolar disorder. So even in high school, he wasn't having problems. I suspected he could have the illness. But the illness can be mild in some people, and it can be fatal in other people. And of course, I was hoping that it was going to be mild in him. And as is most common with the illness, the onset is in the late teens and 20s, and he, at 20, had his first very serious incident where he had to be hospitalized. But up until that time, he went to LSU, he was a walk-on for football, had a great year, and then was really coming into his own academically and developed an interest in physics. He was an excellent student. And so that's when we first really had the crisis, when he was 20.
Now, Dr. Conn, you're obviously a physician. Your son is sick. What did you do?
Well, it's really hard when a close family member's sick for anybody. And being a physician has helped me so much to understand what was going on and help me seek the appropriate care. Because even though I know a lot of the psychiatrists, when something like this happens in your family, it's really shocking and it's hard to know what to do. But so it did help me understand how to negotiate the system and understand actually how ill he was, because I truly understand how people would not recognize it for the crisis it was. And the only reason I was able to is because of my training as a physician. But I did neurology first, which has been invaluable. I'm not a psychiatrist, but there is some crossover in understanding the brain and brain diseases, and I'm so grateful that it's helped me understand what happened. But I don't practice general neurology. Actually, I do interventional pain management and headache medicine. So it helped me because I knew who to call. Okay, so I called a friend of mine that was a psychiatrist, and I just said, my Colin's in terrible trouble, and we need to see you today. And he did that for us. And so he asked me to come get him from Baton Rouge, and I brought him straight to the doctor's office.
Now let's talk about the progress of his disease, his treatments, how he was approaching dealing with his disease. I know he was very determined to work towards completing his degree at LSU. In fact, I believe he changed majors in hopes of learning more from his disease.
He did. And initially, when he was hospitalized, he was very ill. He was having what's called a manic episode, where the brain is just racing and racing. And even though he was very ill, when he went to McLean, we had every reason to believe he would do very well, because most people do well if they respond to medicine and they take their medicine. And that's really an important message. I mean, my son is the exception. He did not respond to medicine, and he had a very severe form of the disease called rapid cycling that most people have. So our situation was just very difficult, but most people respond. And when he went to McLean and got the diagnosis, we thought that he would be on medication the rest of his life, but actually we had every reason to believe that he would do well. But what actually happened is he came home and he never really completely recovered, actually ever, from the first episode fully. And he was just determined to go back to school. He wanted to take 6 hours. We encouraged him to rest, and he wouldn't have any of that. He initially was studying psychology, and then he switched. He was doing a dual degree in chemistry and physics, because what he was interested in was nanotechnology, which are microparticles that hopefully will be used to cross into the brain to treat brain diseases. And he was motivated, of course, by his illness to do this. And 3 or 4 days after he died, I talked to the Disability Services Office, and I just can't say enough about how much they supported him and kept him, facilitated him being able to continue in school. So I was going to request he get a posthumous degree, and they were actually already working on it. And they just did a beautiful job. I'm so grateful for the way it was done perfectly and with such dignity, and I just can't thank them enough.
That's wonderful. Now, the question everyone wants to ask, but is afraid to because of the sensitivity of the issue, is, did you see it coming? I mean, was there a point in his progression that you didn't think or you didn't know if he'd be able to recover from his disease?
Yes. After he went to Minniger's, and I have utmost confidence in him, and then he had wonderful care there. He was there for 3 months, and they did all these drug trials with him and a lot of treatment. And whenever he was discharged from Minniger's, they said he's just not that good of a medicine responder, and it's going to be a struggle. And he came out of Minniger's in 2011, and I knew he was going to be difficult. He was going to have a difficult life. He was probably, I expected that he would have constantly have suicidal feelings, and that's when I really understood that he was not going to be the medicine responder that many people are. He was constantly unstable, having suicidal feelings. He had some other crises where he could have been admitted to the hospital, but we were able to manage him at home. And then I did seek out transcranial magnetic stimulation, TMS, which is really the most avant-garde new treatment for bipolar disorder. And he was having that. And initially he responded some, but not ever fully. He never really responded fully to everything, and he was having transcranial magnetic stimulation at the time of his death. But I knew he was unstable, and there were many, many days I didn't know if he'd make it through the day. And this went on for like 2 years. Just many times I would wonder if he was going to make it through the day. So I can't say that his death was a surprise. It's a tragedy. I miss him so much, but it wasn't unexpected, even though I knew we were doing everything for him. Yeah.
Now, Dr. Conn, you have been extremely open about sharing Colin and your family's battle with mental illness. We have talked about the need to remove any stigma from mental illness and brain disease. And we've also spoken about the fact how this disease is hereditary.
Right, it is hereditary. It does run in the family, which I've already mentioned. Genetic testing is ongoing to try to understand the disease better. Family members are going to donate DNA to be a part of the genetic trials so we can understand the disease better and hopefully treat it better. this is a brain disease, and this is where studying neurology really helped me, because now that we can look at the brain in more sophisticated ways with not just MRIs, but what is called a functional MRI, we can actually see the differences in the function of the brain with people with bipolar disorder and other mental illnesses like major depression. And so, when somebody has a broken arm, everyone can see that. And people have trouble understanding mental illness because they can't, quote, see it. But now we actually can see it in brain scans. And for me, it's like my son went to MD Anderson, the best leukemia hospital in the world, had the best treatment there was, and still didn't make it. And that happens with leukemia. And that's what happened to my son. He had a terrible illness. He had a terrible form of it. He got the best treatment available, and he did not respond. And I just miss him so much. Being a scientist, being a doctor, all that helps me understand what happened. And I'm grateful for that, but it doesn't help how much I miss him.
In closing, Dr. Conn, we all want to thank you so much for sharing the trials and tribulations that you have gone through in facing mental illness and brain disease with your family. I know that you do not want Colin's untimely death to be in vain. So what do you want everyone, our viewers, physicians, patients, parents, loved ones, to know and to learn from your experience?
Well, right, we want to destigmatize mental illness. These are illnesses just like diabetes and cancer and other illnesses, and have our people respond to families and individuals with these illnesses with the kind of compassion and understanding that people respond to with other illnesses. Also, politically, we need to support the funding of our mental hospitals here in Louisiana. We need to improve our mental health care system on every level with more psychiatrists, more social workers, psychiatric nurse practitioners. Everybody has a role to play, and we do as individuals. As individuals, when we hear a story of our friends, family members, acquaintances suffering from mental illness, my prayer is that we'll respond with open hearts and minds and not judgment. Also, there's important research that can be done to help. I have donated my brain to, at the time of my death, to the Harvard Brain Bank, because brains of unaffected family members and affected individuals are needed. Unfortunately, we could not donate Conn's brain to Harvard Brain Bank, but I'm donating mine, and I've had other friends that have mental illnesses and family members with mental illnesses that have agreed to donate theirs too. And it's very important to help us understand these illnesses and hopefully how to treat them better in the future.